Warm welcome to you from Geneva, Switzerland. As you can see, we are 2 minutes and 15 seconds away from kicking off the first of a series of weekly assemblies for the full learning cycle offered by the Geneva Learning Foundation to contribute to the movement for Immunization Agenda 2030. We have literally hundreds of people in the Zoom room as well as across social media, even in our Telegram channel for IA 2030, Immunization Agenda 2030. There are more people listening in. We'll be making comments. We invite you not just to say hello, but to share your thoughts. Tell us why you are joining the movement. And to greet Tembeka from South Africa, Ukamaka Okafor, a PhD from Nigeria, Faiz, a Sudanese physician joining from the United Arab Emirates, Olamiriki Temitope Oluwarotimi from Oyo State, Nigeria, Esther Mulungi, a pediatrician in Uganda. So you can see the list is long, the names are flying by. We're looking forward to joining you. And we also have, let's see, some folks online. Aliyu Abubakar from Katsina, Nigeria. Mecca Kingsley Ukpai, who says greetings. Reda, also from Nigeria. Our very own Amel Altahir sends greetings, connecting from Saudi Arabia. Let's go, let's hit it with the music for the countdown. 25 seconds to go. Countdown with me. 25, 24, 23. And we're almost there to kick off the first of a series of weekly assemblies. 15. And if you're in front of, even if you're alone in front of your computer screen, count down with me. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, here we go. Greetings from Geneva, Switzerland. My name is Reda Sadki of the Geneva Learning Foundation. I'm here, of course, with Charlotte Mbu. Charlotte, how are you doing? How is your connectivity holding up?
I'm doing great, Reda, and I'm so excited to be here. It's a pleasure to meet this great community of immunization professionals from all over the world, and I really look forward to what we have in store for today.
Indeed, we're talking about the future of immunization, but we're not just talking about it. We're actually doing something about it. In the room are hundreds of immunization professionals in our studio, as well as people across social media, even in our Telegram channel. And this is because if you've joined this meeting, you've just connected with the world's largest platform of immunization professionals. This number changes, grows every day. As of to this morning, there were 43,655 immunization professionals active on the platform from 110 countries. This is not only about the connections we make with you, but it's also about the connections you make with each other. We're talking today about a continuum of action from knowledge all the way to impact. And the amazing thing is, as of this morning as well, for the first full learning cycle, we have 6,144 immunization professionals who've been accepted to the full learning cycle for what we call to contribute to the movement for Immunization Agenda 2030. An absolutely amazing number. And I'd like to ask Charlotte, who of course knows the Scholar Pledge for Impact by heart. This is the moral commitment that each one of you was asked to make when you filled out a very long and detailed application. We'll be sharing back the results with you. But Charlotte is going to tell us what is this commitment that each of you, each of us has made.
Yes, Reda, I am committed to work for a world where everyone, everywhere, fully benefits from vaccines to improve health and well-being. As a scholar, I hereby solemnly pledge to work with others to transform projects led by scholars into action and results that will improve immunization outcomes, to share my successes as well as my challenges by reporting on a regular basis on my progress towards implementation, support fellow scholars in doing the same while upholding the highest standard of integrity and behavior. I make this pledge for the health of children and families in my country and everywhere.
Wonderful indeed. And we have so many people joining us, of course, in our Zoom studio, 546 people right now. Please, there is a limited capacity. If you can't join them in the studio, you can join others. Like Iyad Omar, who says, great. Please tell us a little bit more. Why are you joining the movement for Immunization Agenda 2030? Same from Abdirashid Muse from Somaliland. Please tell us, why are you joining a movement to help make immunization better? Weiling Ong sends his applause. Sends applause. Millie Namalwa from Uganda says hello. Please tell us, why are you joining in here? All right, we have Shahid Iqbal, who says, I joined because I learned from colleagues all over the world. It's great to join and have great experience. Please tell us what difference it makes. Ibrima Barrow, connecting from the Gambia. Linda from Nigeria. James Atam Nkrumah from Ghana. And Kabdi Rashid Muse. It's an interesting session. All right, we're glad to hear that. Now, each one of you has made this pledge. And now we get down to business. Business means it's one thing to make a commitment to the idea of a movement for Immunization Agenda 2030. It's another thing to commit to actually taking action. And I'd like to ask you, wherever you are, if you're in the Zoom room, if you're on YouTube, Facebook, and our Telegram channel, to go to the chat. And I would like to ask you if you face any of the challenges that you see on your screen. And if you do, type yes into the chat and send us that message. So if you are concerned about children who are unvaccinated, if you are concerned about missed communities in where you work, not just in general, but where you work, you type yes. If you are concerned by epidemic outbreaks of measles, of yellow fever, or other diseases, type yes into the chat. If you're on Facebook, if you're on YouTube, just type yes and send us that message so we can see that you are facing at least one of these challenges. If your concern is lack of confidence in vaccines by the community, type yes into the chat. If you are concerned because there is a marginalized community, or maybe many marginalized communities, marginalized in any way that matters, that makes them hard to reach, type yes into the chat. And if you're concerned because men, women, boys, and girls are not able to access immunization services in an equitable way because of their gender, those are gender barriers to immunization, type yes into the chat. And if your barrier, your biggest challenge is vaccination for COVID-19, please type yes into the chat. Tell us more if you wish, but tell us at least that, because that is what is founding our movement. In the full learning cycle, you'll be working on your challenge. We have Brian Peters from Liberia, who sent a yes, who's facing missed communities. Ibrahim Ahmed, please tell us, what challenge are you facing? And Amel El Tahir, so glad to see that our immunization family is growing big, and big hats off to you, Amel. I would turn that back to you. Now, we asked you, and more than 6,000 of you told us, what are your biggest challenges? You can see here for the Anglophones on the right-hand side, more than half of you are concerned about adults and children missing their vaccinations. Almost 49.7% of you are concerned about reaching zero-dose children and missed communities. A COVID-19 vaccination is your biggest challenge for 39.3% of you, and disruptions to routine immunization, almost an equivalent number. One can guess the story that is being told here, but we want to hear it from you. And so we're going to mark our first pause now, where Charlotte and I stop speaking, and it's over to you. If you'd like to speak, I'm going to lower all the hands that were raised. And if you would like to speak, you have two simple questions. What's your most difficult and important challenge? And what will actually help you in terms of support? What support do you need to take on this challenge? So please raise your hand if you'd like to answer these two questions. especially if you have never spoken before in this type of assembly. And I'd like to invite especially the people who are joining the movement for the very first time, and also who have never experienced an activity with the Geneva Learning Foundation. If that is you, please raise your hand. We'll try to go to you first. Let's start with Mohammed Farouk, and then with Salisu Ibrahim Hassan. Let's see. So we're allowing you to talk. You need to first raise your hand. All right. Mohammed Farouk, please introduce yourself. Tell us who you are, what you do, and then answer the two questions that you see on screen. Your most difficult, important challenge, and what support do you need?
I'm Muhammad Umar Farouk. I'm working as an immunization officer in Pakistan. Now I have been upgraded to disease surveillance officer, also in the same district. But the biggest challenge which I face over here is the trickle-down training, seriousness, and the management commitment from the government side, especially from the leaders and from the political regions, that the political personnel should be much more involved, and they should participate physically with the government in the immunization campaigns and everything, and in spreading the knowledge. Thank you.
Thank you very much indeed. We have Rebecca Oluwaku also says, who joins the course of yeses. So talking about political commitment, accountability is very much a part of Immunization Agenda 2030. I'm going to go to Charlotte to know who will be our next speaker to answer these two questions. What is your most difficult and important challenge, and what support do you need? And of course, don't forget to introduce yourself. Charlotte, who shall we hear from next?
So, Reda, I'm going to try the agenda card. So I'll invite Kalu Joy. Kalu Joy, if you're able to unmute yourself, please go ahead and do so to answer the two questions. I'm asking you to unmute. Okay, over.
Good evening, everyone. My name is Kalu Joimba. I'm from Abia State, Nigeria. Actually, the greatest challenge I have here in Nigeria is lack of HPV vaccine. Like I said in a challenging story, that HPV vaccine in Nigeria, it is not sufficient, and the ones that are available are quite expensive, making the average family or the poor family not to be able to access the vaccine. It is quite expensive. So it will be an honor if the vaccine can be made more cheaper and easily available to people. Thank you.
Thank you very much indeed. All right, the challenges are many, can be very different depending on who you are and where you are from. Charlotte, who shall we hear from next?
I want to invite Noor Shire. Noor, are you able to unmute? No Shire. If not, Reda, I think we could take Bereho Bosco.
Yes, this is Bereho John Bosco in Uganda, Iruhura district.
This is Noor Shire.
Right.
Okay, please let's listen to Bereho because you unmute. Yes, please go ahead.
Yeah, thank you so much. I'm so much excited to be part of this, and I look forward to learn a lot because like I had presented my case before joining, I have issues with communities which are underreached or unreachable because of geographical or distance issues. So my expectation here is how have others handled these hard to reach areas which are always under-immunized? How well can we budget? How well can we plan to ensure that these communities are not always left behind when we are trying to reach every child in our communities? I stay Barebereho John Bosco, Assistant DHO in charge of maternal and child health services in Kiruhura district, Uganda, Mbarara city. Thank you so much.
All right, thank you very much indeed. All right, Charlotte. So the challenges are many, the support needs are many. And one of the first things we've asked you to do when you filled out that application, remember, is to tell us what they are. And The sharing you will be doing very soon will be sharing ideas and practices that have actually helped you. Charlotte, let's take one more person, and then the focus today, you can see, especially if you attended Teach to Reach last Friday, that this is about sharing of experience. But today we have the practical information, what you need to know in order to actually make progress with your challenge, what support you will be able to access, and how you will be able to depend on your peers, on your colleagues. That is what we're going to focus on today. But maybe time for one more person, Charlotte.
Definitely,
Yes.
Reda. We have
Yes.
Nu Chire, whose mic is already unmuted. So over to you, Nu.
Yes, Madam, thank you very much for chance you give me. I am Dr. Noor Shire from Somalia, and my challenges we are facing in COVID-19 is we have seen many people are not taking the vaccine properly, and they are more afraid that the vaccine might be created some problem, maybe some affected, affected their reproduction, maybe this is some poison like this. So people need more awareness about the vaccine, and this vaccine is only saving them, but not killing them or harming them. The second thing is in our area, in Somalia, Mogadishu especially, we are nowadays facing the shortage of a penta vaccine, which was provided by UNICEF. So we are also
I think we've just lost.
yes.
We've just lost you, Noor, but I think
reaching our target, our coverage in property. So sometimes it's a shortage, and vaccines are out of stock, and we are much balance. The challenges, the main challenges we are facing. So in that point, I add that we have to overcome this issue by underlining and responding that partners like this. Thank you.
All right, thank you very much. And you'll be sharing challenges, but you'll also be going to the Ideas Engine. This is just a sneak preview, and you can go here. For example, if your challenge is missed communities or zero dose, you just type zero dose into the Ideas Engine, and you see all of the ideas that your colleagues have contributed. You can see a few of them here. That is the essence of what we'll be doing in the full learning cycle 4, which is our contribution to Immunization Agenda 2030 and the movement for that. Remember, the idea of the movement, this is a global movement. We need you. We need everyone. We need your colleagues who have not applied to join yet. And this is not pulled out of a hat. This is at the 74th World Health Assembly. The Director General of the World Health Organization called for a broad social movement for immunization that will ensure immunization remains high on global and regional health agendas and help to generate a groundswell of support or social movement for immunization. Now, the practicalities is what we're talking about today. And you know that we're starting today with what we call the Ideas Engine. The Ideas Engine, you take your most difficult and important challenge, and you can go look up, see what people in other parts of the world, or in your country as well, but people you may not know, are doing about the challenge like yours. And you can share your own practices and then discover all these ideas, all these things that people have already have actually done as well from colleagues from all over the world. After that, we'll do that for 2 weeks. So again, we're conscious that your time is the most precious resource, and you'll have the course of 2 weeks, a span of 2 weeks to go in and look at the ideas and contribute your own. Now, after that, we'll be going into situation analysis. Why? You have a challenge. You probably have some ideas, may already have activities to tackle this challenge. We believe it's worth taking a step back and doing a little bit of analysis, thinking through, to get a more complete understanding of your local situation in relation to your challenge. And this time, by participating, starting on the 21st of March, you won't be doing it alone. You'll be giving feedback to others who are tackling their challenges, and they'll be giving you feedback, and you will be helping each other build situation analysis we can rely on, because after World Immunization Week, we'll be launching the IA 2030 Action Plan Hackathon. And this will be over 2 days. It takes just 2 days of problem-solving challenges together, and then a few more days to map out the actions. And you can keep working while doing this. These are light touch activities, not time-consuming ones like webinars and other activities that take you away from your work. Every one of these activities, you'll be focusing on the challenge that matters for you. So this is not like a course where you go and study a subject. What you will be studying is the actions you can take to actually make progress with your work. And then finally, on the 16th of May, we'll be launching the Impact Accelerator. And this is when you take your action plan, you take your situation analysis, you take the ideas and practices that you're ready to that you've committed to, and you begin to implement them. And again, you don't do it alone. You set a goal each week. You figure out, what are you going to have done by Friday? What are you going to have done by the Friday after that? And in that way, we make progress. And then on the 17th of June, we'll be celebrating the implementation progress and early successes of participants in the full learning cycle who've made it through this entire cycle. Of course, we'll be offering 3 levels of certification. We recognize that is important to document, to be able to show, I put in this effort, I did this work, and here is the recognition for it. That is very important. It's the first time, in fact, that at the Geneva Learning Foundation we'll be offering 3 levels of certification. Why are we doing this? Because we believe that your commitment is the one that will make the difference for children and their families where you work, as well as in your country. And why you matter is because Immunization Agenda 2030 says this. You, whatever level of a system you work, immunization staff are the key to leading the change needed together with communities. And they're the key to realizing the vision and the strategy, bringing it to life. If you've looked on our website, you've seen the testimonial, the call from Dr. Godwin Mindra, who says, those of you who have direct contact with the communities, you're the ones who can reach the unreached. If you looked on our website, or maybe you listened to Kate O'Brien say this at Teach to Reach last year, we need people to feel like they have the authority and are empowered to lead change in their community, in their program at the most local level. That is what the journey we're setting off on today. And again, if you are ready and wish to confirm your commitment, go ahead and type yes into the chat. There's right now 745 people in our Zoom studio, as well as many across social media. And I see yeses flying across the chat window. I know there's a delay on YouTube and Facebook, so we'll be seeing the yeses in a few seconds. So let's keep going. Wonderful to see such a commitment. And you may be wondering, you may feel like you're in a room full of strangers. So here we are together, but who are we as a group and as a community? And so here we have the participants by country, and definitely I'd first like to offer a round of applause for people who are the sole representative from their country, because that is a major responsibility on your shoulders. You are the only person right now in this movement, but you can encourage colleagues to join as well. So for example, the one person from Vanuatu, the one person from Ukraine, who I hope is able to participate, from Tunisia, from Tajikistan, from Solomon Islands. We'd like to offer you a round of applause and encouragement to get your colleagues from the Ministry of Health, from the stakeholders, from the country partners, to join this movement and work on your challenges together so that you do not go it alone. And of course, I also want to offer and ask you to, even if you're alone in front of your computer screen, to offer a round of applause to the scholars, the movement members from Nigeria, Ghana, Pakistan, India, Kenya, who are the countries in order with the largest numbers of participants. You can be proud if you are from one of those countries, especially proud: Uganda, Ethiopia, Somalia, Cameroon, Gambia, Liberia, Tanzania, South Sudan, Democratic Republic of the Congo. You can see the whole world is here. Immunization staff from all over the world. The same with the Francophone countries, where DRC, Ivory Coast, Cameroon, Burkina Faso, Guinea are many, and together Now, the amazing thing is that more than almost a third of participants on the Anglophone side work in health facilities. Almost a quarter from work at the district level. 18% work in the regions, and almost 20% from the national level. So this is a movement in which there is representation from all components of the health system, and where we are all together. We're all trying to solve the challenges that are before us and to work together. You can see that almost half of the participants work for the Ministry of Health. So you are literally acting on behalf of your country in your daily work, carrying out what your ministry has planned, has strategized, has committed to. But there's also a large segment from non-governmental organizations, from civil society, and a strong representation from the WHO country offices, as well as from the UNICEF country offices. So you can see, again, broad representation. Most of you are full-time staff, some are consultants, some are volunteers, some are temporary staff, some are teachers, researchers, students. Almost half of you are public health specialists, but almost 20% are community health workers. 15% are medical doctors, and almost 14% are nurses. We also have midwives, pharmacists, and many other job categories. You can see this is an amazing movement. I'd like to applaud all of you, whatever categories you fall into or not. It's amazing to think of this many people coming together in order to make immunization better, in order to make to progress towards the goals of immunization. And you can see online we have, all right, thank you, Gilmis, I'm glad it worked. It's working now. We have many yeses, people confirming their commitment. Millie Namalwa, Haruna Milimono, Benedicta. All right, Abubakar, you check your email, you've received the code. And let's see, Millie Namalwa confirmed, she's from Uganda. Danjuma Abu says, so amazing and interesting. Mohammed Ismail Imam is watching from Nigeria. Annette is from Uganda, and more of Nigeria together with us. All countries, all together for the same purpose, same shared goal of immunization. We know many of you are directly involved. On the Anglophone side, almost 2/3 directly involved in COVID-19 vaccination. Many of you also contribute to the development of your country's national immunization strategy. And then this next one is worth celebrating. This is about your motivation, and it shows basically that those of you who joined the movement, at least, so there's definitely some self-selection, are highly motivated. At your work, we asked you, how often do you feel bursting with energy? And you can see there are lots of 6s, which means you feel bursting with energy every day. And we know some of you are facing challenging conditions. So again, this is worth applauding together. This is worth celebrating together, because if we are going to build a movement together, we also need to care for each other. How often do you feel strong and vigorous? So many of you say that you feel that way every day. And if you do not, well, we'd like this movement, what we're going to do together, to help you move so that you feel that way more often in your work. And again, why do you do your job? Most of you do it because you feel good when you're doing your job. So that is absolutely amazing. I want to finish this sequence before we get down to the practical matters of what we're actually going to be asking you to do in the coming days. With here is when we asked you why to join the movement. Maybe we should mark a pause to hear a couple of more people. So please, I'm going to lower all hands. And we're especially interested in hearing, we know that the entire world is represented. So please raise your hand if you'd like to tell us why you are joining this movement, especially if you've never joined an activity of the Geneva Learning Foundation before, and especially if you are from an Asian country. We've heard many colleagues from the African continent. Let's hear voices from Asia as well. We know that you are very present, very active in this movement. Let's start now. So if you have never spoken before, we're even more interested in hearing from you. Charlotte, who shall we start with?
Okay, Reda, it may be difficult for me to determine who to choose as per countries, but let me just give it a try. I'm going to start with Yahaya Kayemba. Yahaya Kayemba, you're invited to unmute. And then, like Reda said, we are encouraging those from Asian countries who are joining for the first time. Unfortunately, Reda, I'm not able to ask Yaya Kayemba to unmute. I just turned towards Usman Jallo. Usman Jallo, I'm inviting you to try to unmute yourself.
All right, let's keep trying. Getting many comments from
Usman,
online. Tell us just one thing. If you're listening on the YouTube, Facebook, please tell us why you are joining this movement. Type it into the comments. Type it into the chat in Facebook or YouTube or even wherever you may be, and we'll share your messages as well.
Okay, Reda. So Usman Jallo has his mic unmuted. So please go ahead.
Hello, good afternoon, everyone.
Good afternoon. Please tell us where you're joining from and tell us why you are joining the movement.
Yeah, I am Usman Jallo. I am from the Gambia. I work with the Ministry of Health, Gambia. I work as a regional operation officer at the regional level. Work directly with the communities and also with facility level, coordinate immunization activities. I'm motivated to join because I want to tap experience from other regions so that, I can improve services, immunization services general in the Gambia. Thank you.
Okay, thank you so much.
Wonderful, Charlotte. Who's next?
I'm going to call on Irene Opio, that I'm trying to ask to unmute.
I'm asking her as well.
Okay,
Let's see
Irene.
if we can get her online. Irene, are you able to speak to us? Irene Opio. All right.
If not, Reda, I don't know. We could try Professor Becky Tagbo.
All right. And again, we're
to look at gender.
Hello, everyone. Yeah, I'm so excited to be part of this great movement. I'm joining because I have a lot of experiences to share, and I look forward to learning from the experiences of many others from across the globe. Thank you, and over.
I think that says it all, Charlotte. That's
definitely Reda.
All right. All right, now we have to get down to business. We have a lot to cover. One point of order is many of you expressed interest in joining the organizing committee, the coordination, if you will, to support this movement and the work within the full learning cycle. So we'll be getting back to you. We're organizing, we're figuring out how to bring together a committee that will have regional and country focal points. In some countries, in 24 countries, there are existing country teams that are already active, and so you'll be invited to join those. We'll be doing that in the coming weeks, so stay tuned. We hear you, and we're very impressed that basically 95% of those of you who are joining the movement are ready and willing and hopefully able to contribute to the governance. We're also aware that you are very busy, so we want to make sure that you're off to a good start with the activities, with the ideas engine, with the situational analysis, the things that will help you in your work before we ask you to contribute, if you wish to contribute to the coordination of the movement. Now, you've received an important email. It is in your inbox right now, as long as you receive your letter of admission to the full learning cycle, to the movement. It should be recognizable because it has these 3 points: register for the assembly, add the assembly to your calendar, and then double check the assembly start time. Make sure you have this and then what I'm going to show you are really your next steps. So first thing is, right after this assembly finishes, at the top of the hour, you will be receiving an additional email, and it contains several points. I urge you to take the time to read each one very carefully, line by line. Even if usually you're the kind of person who doesn't read instruction manuals, we need you to pay attention to these, at least to make sure that you're off to a good start. Spend a few minutes now to read, and that will save you hours of pulling your hair out later. That is one way to say it. Why? Because there are specific things you need to do, specific steps to get started. And step one is actually connecting with your personal learning dashboard. So I'm going to show you how you do that. And first of all, we're going to get the link right after this assembly. Check your inbox and you'll be receiving a link and a password that is in the email. You'll need these two because we'll be sending you to this sign-in screen on the Learning.Foundation website. Now, if you notice here, you should have all seen this page. There is an IA 2030 members login. So only members of the movement who pay attention and read their emails will be able to access this. So in my case, I put in my credentials. If I'm the only person using the computer, I type remember me. If I forget my password, you can see the forget password link here. I sign in. And this takes me to what we call My Scholar. So it's really My Scholar programs and courses. We call you scholars because you are the learners, but you're also producing knowledge, not only consuming it. I actually believe that knowledge production is the key learning process. What you know about where you work, almost no one else knows, certainly not in the way that you do. And then here you can see the full learning cycle here. You click on Open Now, and this will take you to your personal learning dashboard. So I'm going to just in 30 seconds show you what is going on here. First of all, you can see here there is a 0% complete. As you can see, I'm already behind. I haven't done any of the work. All right. And make sure you don't end up with a 0%. And then there's start the exercise here. You can see the link to the Telegram channel is here. You can see the link if you want to dialogue with your peers. You can see, so here this is actually easier to read on your phone than on your laptop, but this shows you the upcoming events. So you make sure you don't miss anything. You just go into your personal learning dashboard. And if you're finding yourself swamped with emails, there's just too much going on, too many messages on Telegram, what I can tell you is you can simply focus on your learning dashboard. Everything you need to work through the exercise you will find here. So let's see what happens when I click on start the exercise. So we'll start here, and you can see step 1, discover how the full learning cycle works. So again, this may seem like a lot of reading, and there's some videos. You can see I look a little bit startled here, but together with a sort of overall schedule. And then here is a prompt to post a comment. So here you can actually talk back to us and talk to each other. And here it means you'll see there should be a prompt in the comments below. Share with peers. Which activities have you decided to commit to in this full learning cycle? How have you organized your time to honor your own commitment? So that is step 1. Once you've answered that, you can click on complete post, and then you will go to the next one. And then you will go to the next one. So take the time to go through it. You can do it from your phone. And then I'll show you something else is if in fact you are working from your phone and you want to save on bundles, you can go to downloads and you will find the videos that you can download to your phone or your device or your computer and watch them offline. So that should be a lot easier to follow. And you can see there's step 1, step 2, step 3, step 4, step 5, step 6, step 7. Don't be afraid. These are actually quick steps. Yes, there's a little bit of reading to do, but remember, when you study to be a nurse, a doctor, to do your master's in public health, or to be a community health worker, there was effort involved. You do not get something for nothing, and that is the principle that we're applying here. However, once you're off to a good start, you will see that there are many ways in which you can benefit, but you need to get up that learning curve. You need to figure out how this works. The second most recurring problem I want to take on is connectivity. So you can see here that there is another in the email that you'll receive. Let me just see if I can, show it to you. You'll see a blue button, subscribe to IA 2030 radio, all right? And what does this actually mean? Well, if you click on this blue button, I will show you. Charlotte will she may not have the link, so I will, let me just post it for everyone. So if you click on this, what do you actually get? Let's find out. So we're actually going to go click on the link, and you'll see there is what's called a podcast. So it's basically like radio on demand. And so it's audio only. It's a lot less bundles, so a lot cheaper and convenient. You can, even if you have poor connectivity, you should be able to listen to this. So you can see here the available episodes. All right, welcome everybody. We're starting last Friday's opening ceremony, but there's also tutorials. So for example, for the Ideas Engine, we're going to ask you to join the Ideas Engine to submit your idea. And here is my colleague Ian Steed actually explaining step by step how to do it. So I click on this, it's loading.
Hi, this is Ian here. And in this tutorial, we're going to be looking at how you can share your idea or your practice in immunization through.
So that is the podcast, and it is very convenient, a very convenient way you can. There's a little Google Podcast app now. You can also use Apple Podcasts or Spotify, whatever works best in your country, whatever works best for you, and connect to all the audio there. So that is an important step. If you will find the instructions to get to the podcast. Again, everything is in your learning dashboard. So to get to the learning dashboard, just to reiterate one last time, you are going to receive an email right after this assembly. So at the top of the hour, check your inbox, check your spam. If it ends up in your spam, make sure you mark it as not spam, as safe sender. Otherwise, you're going to miss important communication from us that will only come by email. But once you're in, everything happens on your learning dashboard. Now, we have a saying, do not suffer in silence. Charlotte, what does that actually mean?
Okay, Reda, thanks so much. For us in the scholar community, it's like a motto, it's like a mantra that we live by, because you are now part of a community. We are almost like a family, and in the family we share everything. It means if you are facing a challenge or you have a difficulty, please, help is closer to you than you think. So we have several opportunities that you have to be able to get support, to get your problem solved. You just need to ask at the right place, and I'm sure Reda is going to elaborate more on these different opportunities that are there for you to get help, because for us, you are at the center of every action and every activity that we get to carry out. Thank you, Reda.
Thanks, Charlotte. Especially if you've never joined an exercise or a series of peer learning exercises like this, it's going to be confusing at first. You may feel overwhelmed, and that is why we offer many different kinds of support. And when I say we, I mean actually the alumni of our immunization program. So people who have been through this before. They were just like you. They were busy professionals. They signed up for a program, or they applied for it. They were accepted. They said, what is this? How does it work? And they figured out how to do it. Second is we will be organizing two types of sessions. So you can see there is the blue session, which is focused on sharing experience and problem solving. I'm very pleased to announce that Dr. François Gass, a legend in the field of immunization, and that is not exaggerating, has accepted the invitation to join us twice a week to help you problem solve, think through, give feedback, share his experience, share his advice on how to problem solve the challenges that you are facing. I'd like to turn to François, and I hope I haven't embarrassed him with this kind of with this introduction, but it is true that we are grateful that he is taking time out to help you problem solve your challenges. François, how are you doing? What would you like to say? What can people expect if they come to these share experience workshops?
Hi, Reda, and hi to everyone today on this session. I'm pleased to learn from you, and maybe learning your experience is critical because nobody has the same experience as you, the specific problem you face, and sharing those problems and sharing the experience of others who may face the same problem and have found a solution may help. It's a sort of sharing both ways and learning both ways. And I will be a listener and maybe just ask questions where I would like to understand more the challenge you face, and maybe I need to listen to find more concretely what the solution was carried out in one country that successfully addressed your challenge. And this may not be the same environment, may be different, but I think the more we are, the more we may find people sharing the same experience, some having solved it, and some learning from what the others have done to solve it. So I'm looking forward to build on my experience, because I think the world is different today. We have out of the pandemic than the world I've faced in the past. So I'm going to learn a lot from your experience. Thank you to you, Reda.
Thank you very much, François. Charlotte, can you give us the specifics? When are these sessions happening for Anglophones? And it is, I believe, twice a week, but what days? And how does one sign up?
Okay, these sessions will be holding every Tuesdays and Thursdays for the Anglophones, and you're going to receive the mail with the links on how to join. But also, once you log on to your personal space on learning.foundation, all the relevant links are there. You can also add the calendar to your event. Thank you, Reda, for sharing the link also in the chat. You can, even right now or after this meeting, click on that link to register. So I'll advise you just to copy and paste the link, even if it's on a Word document somewhere on your computer. After this, you click on it to register for the event.
Now, I'm going to share with you a secret, and that is these sessions are 30 minutes long. And we know time is the most precious resource. And so we time bound these sessions. And you may think, well, how can you do anything in 30 minutes? But at the same time, when we ask you, what is your biggest challenge to participation? You say, I don't have enough time. Now, with François and Charlotte, what they will do is they will say, does anyone want to take more time to explore the challenges? And if you want it to last longer, we will accommodate you, or we will try, so that we can keep discussing and problem-solving challenges. But we respect your time, and I hope you will see this every step of the way. We keep it short and to the point. There's no fluff. There's no time spent on presentations or formalities. It is all about you, the problems you face, and trying to help you and trying to help each other in facing these challenges. Now, because it is a new methods, new platforms, we ask you to register on these platforms, create accounts, you have to use passwords and so on. Some of you are going to need technical support. Some will get stuck. You won't find the email you're looking for. You will forget your password. You won't remember where is the address that you logged into. And so for that, we have the technical support sessions. Charlotte, what are the times and or what are the days of the week? I think the times depend, of course, where you are. But what can you tell us about the technical support sessions?
So really the technical support sessions are every Wednesdays and Friday, and they are, if you are having problems with maybe how to join Telegram, understanding how the platform works, joining the ideas engine, you join this session as alumni from TGLF program. Will be there to give you support. Remember, we said our mantra is do not suffer in silence, and we get to work together, learn together. So it's really about coming to receive the support that you need. You can also have the opportunity to connect one-on-one with an alumni that volunteers to follow you up and give you the support that you need as far as moving forward with the full learning cycle is concerned. Thank you, Reda. Over.
Thank you very much. And in fact, you can see that all of these little clips that you're seeing here are from the email that you have received and the email that you will receive at the top of the hour for this following this session. So check your inbox. The email is there. Check your spam. Check everywhere. And if you have trouble, then come to the technical support. We'll help you figure out how to make sure you receive our emails. Now, some of you are also going to be doing just fine. So if that is you, don't worry. There is only one thing we ask you. And you'll see in that same email where we have a big red button, do you have problems? Do you want to leave the movements? We ask you questions like that. We also just ask you with a green button to say, yes, I am active in the movement. All right. So you just click there, and then we only ask you simple questions. How are you doing? And you can see option A. The very first option is, I'm doing just fine, thank you. All right. So if you're doing fine, and most of you will do fine as long as you read the instructions and take a little bit of time to figure things out, tell us. Conversely, if you have a problem, then you can tell us what type of problem, and we'll have some suggestions for you. Now, if you miss the assembly, if you've taken our courses, you know we're very rigorous about absence. We ask you to do a catch-up task and so on. There's none of that here because this is a movement. We want you to be here because you want to, because of the commitment you've made. So when you receive the big scary red button, click here to avoid removal. We're not actually talking about removing you. We're asking you to just tell us, what is your status? Give us a status update. Are you actively participating? Are you still committed to the movement, but right now you just can't dedicate time to it? That's option B on screen. And then option C, if you actually wish to leave the movement, please let us know so we don't continue sending you emails, asking you questions, and sharing opportunities with you. So I hope that is a helpful summary. I want to stop here because there's so many good comments online. All right, let's see. Mudassir Abdullahi, who says, I joined the movement to explore other people's experiences so I can contribute towards achieving immunization agenda. Thuro Samson getting us loud and clear in Kenya. Joseph and Gugi joining to learn and share experience with others globally. That's great. All right, Sandashi Bombwe from Zambia enjoying the presentation. I hope it's also useful to figuring out what you need to do, when and how. Ukeme Feoma from Nigeria. Sfundo, gratitude from South Africa. I joined the movement because I want to learn more about immunization agenda and the global health system, how they are tackling vaccine hesitant in local communities and misinformation about vaccines. And then Zest Flounce, please tell us where you're from, who's joining to learn and develop with others globally. That's all. Every person who's joined, remember, it's more than 6,100 people who've made that commitment. You answered more than 95 questions to apply for the movement, so we know there is some commitment there. Nobody answers 95 questions in the questionnaire unless you are actually interested. And now is the most important part. I'm going to show you what you get as members of the movement. The first thing you can see here is what we call the IA 2030 Ideas Engine. This is something we developed with frontline immunization staff facing the early consequences of COVID. Dr. François Gass, Ian Steed, who actually built the Ideas Engine, together with Charlotte and Boo and the rest of our very small team, put together this platform on which you can actually go in and look up ideas that have been shared, practices that have been shared with enough detail, enough information that you can make sense. You can determine, can this be useful to me? Is the context sort of similar enough or too different? What can I say about this? And so you can not only go and consume, look at other people's ideas and practices, you can also add your own idea. And I'm actually going to show you how to do that in a few seconds. So let me see if I can get to the right place and the right time. It's not the easiest platform to use, but it is well worth the effort. So once you make it, and this is reserved for members of the IA 2030 movement. So you cannot just register for this. You need to be a member. And Ian Steed and our team will actually be sending you the magic link in order to create your account on this platform. Now, this is the live platform. And you can see here that you have the strategic priorities of Immunization Agenda 2030. And many of you will probably be interested in this question of commitment and demand. So that includes things like vaccine hesitancy. So let's click in here and let's see here what actually happens in the Ideas Engine. So here you have background on the key areas of focus, sort of breaking down the strategic priority into different components. And then you can either add your own idea or view submitted ideas. So right now we haven't opened it up yet. There's just a few test ideas. But let's see what happens if you click on Add Idea. All right. So here you have the title. The title is very important because somebody else who's looking for ideas, in many cases, all they will see is the title. So make sure you pick the title that actually will help someone understand what is the idea. Then the language, if you write in English, don't put French, don't put Français, or vice versa. And then we have a series of questions. Is this based on your experience? It's a practice you've actually done or directly observed, or is it an idea? And both are interesting. You may have an idea that seems good, you haven't implemented it yet, share it, all right? And people will give you feedback, and maybe somebody will come back and say, I've had this idea, and here's how it turned out. Because then we will be crowdsourcing ideas and practices. But it's true, personally, I prefer the practices. I want to know someone has actually done something. It's not just something they cooked up one morning. Now, of course, because of the pandemic, we have to ask, is it related to COVID-19 vaccination? Is it related to recovery of routine immunization services or not? All right. And then we have the key areas of focus. So if you're familiar with Immunization Agenda 2030, you'll know what this is. If not, go to your learning dashboard. Let me see. Yeah, here, because you'll be able to, you'll get some background information and you'll be able to learn more. Your learning dashboard is going to be your best friend throughout the full learning cycle in this movement for Immunization Agenda 2030. And then here, once you have filled in these different, so let me see. I say this is a practice I want to share. And then you have these two fields. Describe your practice. Tell us about it. Share your story here, and then tell us how you're measuring implementation. So yes, even when it's an idea, we ask you how you would measure implementation. And then at what level of the health system? Is this your personal practice? Is this for your facility, for your district, for your province or region, for your country? Is it included in your Ministry of Health plan at your level? So this could be your micro plan, or if you work in the capital city, this could be your country's national immunization strategy, formerly CMYP. What have you learned from this practice? How does this relate to COVID-19 and so on? So you can see, you can also add attachments, reports, evidence, you're documenting your practice, whatever is most helpful. So that is the Ideas Engine, and it is an exclusive only available for members of the movement for IA 2030. So what you'll be receiving the access, the keys, the password, and the login information to access your learning dashboard. Don't confuse that with the Ideas Engine. They're two separate platforms. You will have two separate logins and passwords. Unfortunately, we do not have single sign-on. We wish we did, but we don't. So please, if you can be indulgent with us. And of course, this enables you to quickly look up ideas, experiences, share your own, and connect with individuals who originated them. So you can actually, so Malek asked what kind of evidence and documents. So this can be the micro plan. If it's a practice and you've done it and it's in your micro plan, just upload your micro plan. If you want to upload anything that can be helpful to others. And again, it's about helping your colleagues make sense of your practice. Does this work? What are its limitations? What's good? What's the context for it? So that can be very helpful. Now, we have again two questions, and I'm going to turn again to Charlotte. Perhaps we lower all hands again, and this time, we're actually going to do it. We only have 6 minutes remaining. What is an idea or practice that you'd like to share, and what ideas are you looking for to help you with your challenge? Charlotte, who shall be our first speaker? I see several hands already up in the air.
Yeah, so Reda, I actually invited Fatou Cham to unmute because that was the first hand that was raised. So Fatou Cham, you go ahead and unmute if you are able to do so. If not, we are going to turn towards Sarah Mohammed. So the first person to unmute, right. And then there is a raised hand from a Zoom user. You didn't use your name to identify yourself. So I'm just inviting. And we have Suni Raja. So
yep, Zoom user has unmuted. Yeah. Please introduce yourself, and you can rename yourself, but just tell us who you are. And then what is the idea or practice that you want to share? What are you looking for to help you with your challenge? Go ahead, Zoom user.
Hello.
Hi.
Yes.
Hi. Good evening. Here I am from the Pakistan, Sunil Raja. I've been working in routine immunization and polio program now in the COVID. I am looking after the communication component. So yes, I have a lot to share since I have been working for a very long time, for the many years here with the UNICEF, WHO, and the EPA program. So the idea I am looking for to help is currently we have the issue that how we can improve the routine immunization in the scenario of COVID. So both vaccination is going on in the health facility, and same health facility is the serving for the routine immunization as well. So most of the time, the cold chain system and the other logistics is also being supplied by the EPA program. So currently, the vaccinator The one who is the frontline worker is the overburden for the routine immunization responsibilities as well as the COVID responsibilities. But yes, of course, I'm very ambitious, and it's a very, very good practice to have the experts from the globe to see online and have their ideas. Yes, I have also a lot of the ideas how the Pakistan has a good figure in terms of the coverages. So recently we had the mass campaign in the Pakistan. So that has also a good coverage. Like I can share with you that more than 80% around the first dose and the more than 70% the second dose. So the coverage figures are very good and satisfactory, and we have the lower the load of you can say the hospitalized patient and the death rate. But at the same time, when we look at the coverages of the routine immunization, it's not so much improved as we think it could be because of the COVID. So recently, the good initiative that taken by the government and health authorities is the separate hiring of the COVID vaccinators. So previously it was the, you can say the paramedic staff, nurses, vaccinators, all together they were working. But rightly, they are dedicated staff is being hired and being trained, and they are working. So this is the one part is the good. But the second part, if we look at the COVID figure, the routine immunization figures, yes, we have a very good chunk of the zero-dose children and the defaulters. So hopefully I will share more stories that I have, and I will try to learn from the more experienced persons in the today's session. Thank you so much.
Thank you very much indeed, Sunil. Let's hear. So we've got 2 minutes left, but we have one last thing we want to ask you to do before we wrap up. Charlotte, one more speaker.
Yeah, Reda. So earlier on, Zoom user actually got to unmute, though we didn't hear from them.
Yes.
So please go ahead, introduce yourself.
Yeah. Yes, you can hear me.
Yes, loud and clear.
Yeah, this is Kai from South Sudan. Many of you may hear about South Sudan. Here in South Sudan, we have a lot of challenges concerning being missed vaccine, being logistical supply. The places are very far. People are not getting there. Food infrastructure, no roads, no qualified health worker, lack of qualified health worker. We have a great challenges, but we are trying our best to vaccinate each and every child in the facility. But still, the perceptions for the community concerning vaccination is they have negative perceptions. We are doing our best to educate them, inform them, and they are taking. But still, the immunization uptake is very low in South Sudan, I can tell you. Thank you.
All right, thank you. All right, we're out of time, unfortunately. I see 25 hands raised. We still have 690 people in the Zoom room. This is just amazing. I have one last thing. We understand, with the understanding that this is a movement, and Charlotte knows what is going to happen. Can you explain what we're going to do now, Charlotte? With music that may be a little bit dated, but and unfortunately we can't bring everyone on screen, even if you have your webcam. But what happens now, Charlotte? How do we end this first assembly?
Okay, so I would like to invite you all, wherever you are, whether you are in your living room, in your office, in front of your computer, in front of your phone, wherever you are, just take a pause right now. But we are the IA 2030 movement, so we are supposed to be in motion. You've been sitting for long, so can you rise on your feet and put your hands together while you take some moves, dancing to the tune of the music that is playing now? It may not be your best, but you can actually do something about it.
There's a melody and there's rhythm, right? Thanks, Charlotte. It is a movement, so let's move together. You've been sitting for an hour, so please get up. Maybe your colleagues will look at you funny. Maybe your colleagues will have a good laugh and they're, what's wrong with him or what's wrong with her? But this is a movement, so please get up and move and dance. So I'm sure that amongst immunization staff there are some dancers. And please confirm if you are dancing, type dancing into the chat. Let me know if you are dancing. Just type dance into the chat. Alright, yes, or put the dance icon. We still have many messages coming in. Dr. Zimbo from Myanmar. Elmerson Bulamu, proud to be part of this global agenda. From Uganda, Dr. Marwa, so proud to be part of IA 2030. Great opportunity, says Yahar Zimbo, to improve EPI. This is Dr. Zimbo from Myanmar. My challenge is how to minimize defaults and trace tracking of defaulters. So please type dance or use the dance emoticon if you are in fact dancing to this music. From Zamfara, Nigeria. Alright, Millie Namalwa confirms she is dancing, and I hope she is not the only one. Thank you so much, very much indeed. Let's go now to Asia because we have the whole world with us. So let's have a little bit more of an Asian flavor to the dance. All right, still 654 people in the room. This is just amazing. Mariam Noor, I hope you are dancing. You've just sent us a message on YouTube. So please confirm if you are in fact dancing with us. We're over time, so if you need to get back to your duties, please do that first and foremost. This is about helping you with those duties, with your challenges. But if you have a minute or two to move with us, this is the movement for immunization, so show us your moves, if you will. All right, Mariam Noor sent some dance icons. I knew it, Mariam. Of course, if you feel appropriate and dancing in an international context. All right, then, Juma Abdu. All right, please send us your messages if you're watching on YouTube, wherever you may be. All right, and we also have some folks on Telegram, so I hope there's some messages there. Okay. And still 619 people in the room. If you're Jovita Yugos is happy to be here. Chepi Latte from Yaoundé, Cameroon. It's nice being here. I am dancing. All right. I'm sure if there were 609 people in the room, we would be making at least this much noise. All right, so please, and again, remember tomorrow we have some concrete activities planned. We have both the sharing of experience and the technical support. So please, all right, maybe I'm looking for the most appropriate music. Looking for one last sound as I review what we're actually going to do. So let's get a little bit mellow here. And I hope you've never had anything like this. You probably attended many webinars, and I hope you've never experienced anything like this before. But this is just the beginning. All right, thank you, Abdullahi Maiwada from Yobe State. Bala Al Hassan, we're proud that you are with us, that we are together. Bala, thank you, Millie. And just as a reminder, here are the concrete actions. Do not suffer in silence. You have any kind of problem, check your emails. It's all there. If you have poor connectivity, you can go to the podcast. The learning dashboard is your best friend. If everything is fine, let us know. You see that big green button. Yes, I am active in the movement. It's inside your email. Click on it. Let us know how you are doing. Right after you leave the Zoom room, you'll see a survey pop up on your screen. Please take the time to complete it. Let us know how you're doing. If you are having any problems, we'll also share again the instructions for how to sign up for tomorrow's help sessions. And if you missed it, please, if you have colleagues who missed it, please let them know that they really missed something worth attending. And again, if you see the big scary red, click here to avoid removal. Don't be scared. We're just asking you to confirm. We don't want to keep sending you emails if you're no longer interested. So please just join, just respond so we know how you're doing, and we can continue to support you in the right way. All right, we'll end here. Thank you once again. and we'll see you soon. Charlotte, last words? I think you should get the last word today.
Thank you so much, Red. I'm really looking forward to meeting the whole team tomorrow, 5 p.m. time for the experience sharing with Dr. Francois Gaz and myself. And on Wednesday, technical support session, I'll be there with Ian Steed because we'll be looking at the IDS engine as well as alumni of our program. But one thing I want to assure you, as we have said, we are a movement. So we have started to move. We are not going to stay on the spot. So as the days go by, we'll be moving forward towards one single direction. That is the agenda for immunization 2030, meeting the world's objective as far as immunization is concerned, getting every last child, every last person vaccinated against that preventable disease. Thank you. I look forward to moving with you. Bye for now.